The water make it heavy.
Hello. Good morning.
My name is Evelyn.
Miss Evelyn, you came out to the health fair here at Gordontown Community Center with the JAHJAH Foundation.
Yes, when I heard about it, I needed to come see the dentist.
And how was the treatment?
Excellent.
Big question for you. Are you happy that the doctors came to see you today?
Yes, very happy. Only pity we did more early on. Right. Because it's only when I come to the health center, I heard that they would be here.
I got a good cleaning and I got me a referral to go check out my bite. Where when I bite, I'm biting on my nerves.
Very pleased. I'm very pleased of it. We can't do dental here, we can't do eye here. Right. Only for things and we just cannot do it here because it's very expensive. So, yeah, I'm very pleased about this and I'm happy.
So I'm gonna get it checked.
So you're happy that the JAHJAH Foundation came here today?
Yes, I am glad.
Okay,
It was excellent. You have a great day.
Thank you for coming out.
Okay.
This is his very first cleaning ever.
Yeah.
24 years old.
Wow.
Yeah.
Big man for a dentist.
No, he's not afraid. Just something new. He's going to be going regularly after all of this.
Very good.
Oh,
Tell mom you call her back.
I'll call you back. If anybody asks.
What's up, G? You have a seat right there.
JAHJAH Foundation is doing an excellent job by coming back in these communities where the people are underserved to offer services that are not readily available as needed.
How's things going so far?
Very well. Nice flow this morning. Number system works great. We are seeing a lot of patients, and we have a steady flow coming in.
Thanks for all you do. Okay.
You're welcome, anytime.
For example, a classmate of mine left all the way from Kingston to come up here to get service this morning. When she heard that we were going to be here, she went to the dentist, she came back, and her response was, "I'm so happy I came. They took out both of my teeth and they were so good. They were professional. I'm so happy."
What's your role here today?
This is the last stop after the patients are seen, whether by the dentist, the gynecologist, the medical doctor. We don't miss a beat, because if someone did not get any particular information, we will get it here.
This is the discharge section.
This is the discharge section. And of course we do the teaching, so generally I look at the documentation to see what they're being seen for. And as a nurse, we're very strong when it comes to patient education. So no better person to put at the discharge desk than a nurse. Not that a physician can teach, but I'm just talking about our strength. And I also have to direct them if there needs to be a referral. And the most important point is to emphasize that we're only here for a day or a couple hours. So they must see their local physician.
Right. Follow-up is important.
Follow-up is important.
Are you pleased with the turnout here today?
Yes. I mean, we could have come here and there wasn't anyone, but today it's going well so far.
All right, well, thank you for all you doing.
You're welcome.
I'm Patrice Gordon-Poyser, a member of the JAHJAH Foundation.
All right, so we're here in Gordontown Community Health Fair. Please tell us what's going on.
We are in the Gordontown community today in the luscious Blue Mountains, providing medical, dental, and gynecological services to the community members. Things have been going very smooth. There is a lot of order. The patients came in very early. They were instructed of how the flow will be for the day, and they've been very cooperative. And the ones who have already been served, they're very appreciative. We've gotten several compliments that we're very organized, and they really love what we're here doing for the community.
Have you ever been to Gordontown before?
I have not. As much as my last name is Gordon, I've never been to Gordontown, and I'm happy to be here.
Okay, well, thank you for all you do, right?
You are welcome. JAHJAH Foundation.
I am Lauren Peart, a resident of the Gordontown community.
I am Dr. Trevor Dixon, founder and CEO of the JAHJAH Foundation.
Right, so we're here at a community health fair, JAHJAH Foundation community health fair in Gordontown. Yeah. Tell us how you put this together.
Well, I want to thank my cousin here, Trevor, for giving me the opportunity to give back in this way to the community. Right. Like I said, I'm a recent resident here, and I have first-hand insight in the challenges that the community has, the low-income community of Gordontown and surrounding areas, and I really want to thank the team for coming and putting on a very good health clinic. A lot of people have benefited.
So what made you want to do a community health fair here?
Again, just being here and seeing the needs. You know, a lot of people, a lot of people just cannot afford basic health care. There's a health center down there, but that staff down there is overwhelmed. And on any given day when you pass there, there's a very long line out there.
Oh, okay.
Yeah.
Are you pleased with the numbers that were brought here today, the doctors, the dentists?
Yeah, man, for sure. And it's definitely had a big impact. People have been calling me and telling me that it's the first time they're getting the teeth cleaned in years. You know?
All right, Dr. Dixon, tell us why you came on board here.
I came to visit Lauren, lower down in Gordontown, off Maumee River.
Maumee River, yes.
Right. And I saw the amount of children that would come up into his yard, and he's feeding them, he's talking to them, he's giving them different things. And I said, wow, this is in Kingston. And he explained to me that a lot of the citizens here, they don't go into Kingston. They actually stay up here, and then there's a lot of needs up here. And he took us to back by the river where we saw that there are the whole community back there, and they don't really access healthcare so readily.
Right. So I see we brought the mobile dental clinic here. Tell us about the operation here. What did we bring up here, Dr. Dixon?
Well, we have all the services that JAHJAH Foundation offer on our medical missions. We have medical care where we check for diabetes, hypertension, and even other diseases. Our team is made mostly of emergency medicine board certified physicians, so they can handle any range of problems, and we can identify patients who are at risk, like people who have blood clots, people who are having chest pain, people who are having diseases that we're trained to recognize quickly. So, and on most of our missions, we identify people who are at risk, and we have a good relationship with the Kingston Public Hospital and the University of the West Indies, and we can refer them. Yesterday we referred a patient to the Kingston Public Hospital. We brought him down there, and he had a blood clot in his leg that could travel to his lungs and kill him. So we offer a wide range of services here. Obviously, you see we have a dental mobile bus here. It has 2 chairs in there, which allows us to see patients faster and more efficiently. We also have dentists over at the community center. There are about 3 or 4 dentists up there. So the dental care seems to be the biggest need in most of the communities that we go to. Whether in Gordontown, which is a little bit more rural, or whether we're in inner city, Fletcher's Land, where we went yesterday, dental care seems to be the big problem. And we have a team that's not just numbers, but they're highly qualified. One of the patients told us yesterday it's the first time he saw a child and numerous children go to see the dentist and they didn't come out crying. And that's to show you the level of tenderness, the level of making sure your patient is well anesthetized before you actually try and do cleaning or extraction. Although the dentists here tell us they try not to extract teeth from children, so they're still in a stage where their teeth is very important, so they try to preserve them as much as possible. And we have cervical cancer screening also. We have women's health there. We have 2 gynecologists, board certified gynecologists who come and do pap smears, and we get all these results to the national lab so the patients can get the results to their local health centers in a timely manner.
So high level of care here. I'd be remiss if I don't refer to
Miss Lou.
Miss Lou right here.
Miss Lou. Yeah, man. I have to
How symbolic is this for you?
Oh, definitely. Very, very symbolic. We know what Miss Lou stood for. She was definitely a champion of rights, human rights, Jamaican rights, you know everything patois related, etc., and community related. So, and she's from this community. So, yeah, man. Thank you.
Okay. So, any last words you want to say to the JAHJAH Foundation and to our supporters?
Thank you. The community needed it. I wish you could be here all week, Dr. Dixon, but unfortunately it's just for the day. But I hope we make this a yearly.
Yeah, man. I hope we'll be back. There's lots of need. We try to spread the love throughout Jamaica.
Yeah,
you know, we go everywhere. You know, our motto is like, real work, not chattings.
Yes.
Number one, and more importantly, it says this is our people and this is our problem. So we try to see how we can help.
Yeah, man. Thank you.
All right. Well, thank you both.
JAHJAH Foundation.
Boom.
Boom.